for that. Let's go to the health diary and let's talk about COVID-19. And the infection rate has been dipping for a while now, with the positivity rate now standing at 0.3%. But the Ministry of Health warns it's not time to lower our guards yet, as we might experience a surge again. Our health and science reporter Beldin Waleula joins us right here in studio. Beldin, good morning. How are we doing so far in terms of combating COVID-19?
Good morning, Maringa. So far, we can say so far so good, because the positivity rate has been below 0.5 or below 1% for quite some time. The Ministry of Health says that it's not time yet to lower our guard, because in Kenya, we've been having a cycle of 3 to 4 months, then we have a surge. So since Omicron came, we, according to Dr. Hwale, who I spoke to some time back, he told me that the next 3 or 4 months after Omicron comes to March and April. So this March, end of March or April, we should be experiencing a surge, and therefore Kenyans should still be on the watch out, wear their masks, and ensure that they observe the measures. Because you see countries like, for example, now Hong Kong, they're experiencing a surge. The doctors there have no oxygen. They're overwhelmed, the hospitals, and they just came from 0 COVID-19 cases to a surge. Same to Thailand, same to New Zealand. Even the CDC and WHO have issued a travel warning to New Zealand and Thailand and Hong Kong. Therefore, Kenya is not out of the woods yet, because these countries had 0 cases and now they're overwhelmed. So Kenya also, if we still have the cycle of 3 to 4 months, then around April we should see some cases going up, and therefore everyone should be on the watch out. Maringa.
Indeed, Beldin, we are seeing what's happening in Europe, and rather in the European continent, and the war between Ukraine and Russia, attacking Ukraine. And we've seen that, perhaps that region, those are countries that have been affected by COVID-19 in the past, and the cases have, dealt a blow on those countries. When all this is happening, there's no social distancing, as it were. People are moving from country to country. Perhaps have you interrogated and, a projection of how perhaps the cases might, surge or remain the same in that part of the world?
Maringa, what we can foresee is a surge or a catastrophe in waiting, because you see these people are moving from one place to another. Remember also a country like Russia produces Sputnik, so the region that depends on Sputnik, the production also has been affected, and therefore moving from one country to another, we also see new variants coming up, and therefore we're hoping that WHO or the other international bodies will come in to ensure that those moving are fully vaccinated, but it's a catastrophe in waiting.
Finally, Beldin, when you look at the country and, having been at 0.3%, the positivity rate, so far as you went up, what is the projection of Kenya moving forward, even as you were granted the mRNA to produce vaccines?
The projection of Kenya moving forward is to ensure that everyone is vaccinated. What the Ministry of Health is trying to do is call out on people to get vaccinated. The numbers of vaccination have also dipped, because we're only doing 20,000 vaccination per day against 100,000 vaccination per day. So just to call on everyone to get vaccinated, because that's the only way to fight this pandemic.
And are Kenyans taking the booster shots?
Yes, the numbers are going up, but booster shots, you have to take it after 6 months of receiving the second shot. So those who received their booster shots around December, or the second shots around November or December, they still have some time to wait for their booster shots. Yes. So far so good.
Indeed, thank you so much. That is Beldin Waleula, our health and science reporter, joining us with the Health Diary. Thank you so much, Beldin. And let's now give you today's dose of what's trending. And Mike Sonko and the family have been banned from the US over